So we're here today with Patients Know Best, or PKB, to talk about them being a member of the Patient Source Partnership Programme. So we have Dr. Mohammed Al-Ubaidi, and we have Sally Renison, CEO and Vice President of Sales, and Dr. Phil Ashworth and Mike Brooks from PatientSource. So it's lovely to have you. Thanks for joining us. We'd love to know a little bit, Dr. Mohammed, about how PKB started and why you're called Patients Know Best.
I'd be delighted to. So this came from my research and my personal experience. So I was doing some research in the USA for US hospitals about how to share medical records with patients. And this doctor told me about a patient he'd seen with chest pain.
Yeah.
And he thought the patient had a tear in his largest artery, aortic dissection. So he sends them for a CT scan. And the radiology report comes back. First line is, there's no aortic dissection. Doctor is very busy. He moves on to all the other patients he's looking after. But that month, he was trying out giving the patients their medical records. So the patient emails him saying, "What's a thyroid?" And the thyroid is just on your throat. And the CT scan is on your chest. So he says to him, "Why are you asking me?" And he says the last line on the radiology report said there's shadowing on the thyroid. So what's a thyroid? And that's when the doctor realizes the radiologist was warning him in the last line that although the chest is fine, the throat has cancer. Luckily it was picked up early, and bring in the patient, take a biopsy, take out the cancer, patient's fine. But from that point onwards, that doctor starts asking all his patients, "Can you look at the information with you? We're on the same team. I can't know everything." So he was he's human, so of course he makes mistakes, but he was unusual in how he reacted to that.
Yeah.
So as he was doing that and telling me the story, I thought of my own experience. So I have a rare disease, and when I go to see my doctor, he panics, doesn't know what to do. And I tell him, my immunologist said this, and my ENT said that, and they think you might want to do the following, and he does it. And when I was writing the book and hearing that story, I realized they weren't trusting me because I'd gone to medical school. They trust me because I'd gone to all the appointments.
Right.
And that's what the patient does. You are the only person who was there. You were definitely the most interested person in what happened when you were there. And so not every patient knows best, although a good many of them do. But if you give them the information, that is our mission. You may not know best when you start, but we want you to know best by the time we've finished doing our work for you.
Wow.
And so that's the mission of the company. We want to get everyone to know what's happening and get the best outcomes through being part of that whole medical team looking after their health.
That's so important. It just seems also like we've chatted before about the fact that it should be the status quo, that you know what's going on with yourself. So yeah, but it's obviously not, which is why we have you.
I think it's the kind of thing where you'd look back on it in 10 years and say, how on earth did we manage to practice medicine and think it was safe without that environment?
Yeah.
But we're getting there.
Great. So it's keeping the patient at the autonomy of their own sort of health journey, and knowing that, yeah. So what is the partnership with PKB and PatientSource, and why is that important?
Well, it's very important for us because PatientSource has an ethos of creating a patient-centric care system. So our approach is a clinician-led design system, very user-friendly, but you've got a patient-centric view within this. And PKB bring a very important element to that, in that rather than PatientSource trying to do everything, we focus on what we're good at, which is a clinician-led design system for clinicians.
Yeah.
And PKB bring this really important element of that patient involvement, which extends our patient-centric view into the system. So our partnership program is designed to really allow customers and healthcare organisations to extend their system in all sorts of directions, and PKB really bring a really important part of that to this.
Fantastic. Sally, can you sort of elaborate a little bit about the involvement of the patient and why that's...
Yeah, sure. So I think there's two components that we kind of touched on there, and what we love about our partnership with PatientSource is it's all about that. Going right back to the mission, which is PatientSource have all this data that's being led by the clinicians, and this is about, okay, how can we most easily get that into the hands of patients, because it should be easy in this day and age.
Yeah.
And where you've got two companies that are aligned in that mission, it makes it easier for the hospitals, the healthcare providers, to do the right thing, to say, yeah, actually, we know we can just give this data really securely, really safely. But then for us, it's coming back to that wider ecosystem. And I think this is really probably the whole point of your partner program, isn't it? Is that you're trying to bring people together that are like-minded, that have got products that are complementary, to look at how that whole end-to-end pathway can be supported by people that want to do things. And what we try and bring to that is the role of the patient. And this goes back to Mohammed's story, which is you can have the most efficient clinical pathways, and you could have all the right systems for the clinicians to use, but unless you've got an activated, empowered and engaged patient, we're never going to be able to deal with the problems that the NHS has got in terms of capacity. We're just not. The role of the patient has to be acknowledged and become part of that, and that's really what we're trying to do as an independent company. And it's great when we can do that with partners, where the whole ecosystem brings the patient in, not just through a patient-centric design, but actually a participant within the healthcare that's being delivered.
Yeah.
I guess that's what we're really trying to do all together.
Yeah, it's so interesting about the way that you phrase the ecosystem, like having everybody together. And I suppose that helps, at the end of the day, the client, because they don't want to have to, it's all amalgamated together already for them. So on that note, Mike, how do you feel it sort of benefits the end user having this partnership?
Oh, it's ideal. It means that the end user is going to get the best tools for every little facet of medicine they're dealing with, without having to compromise.
Yeah.
So in the case of PKB, when I was at medical school some 15 plus years ago, we were told medicine's changing now. It's no longer this paternalistic world. Patients are now more involved in their care. And I was trained from day one to take on board the patient's perspective, and it was frustrating not to have systems to back it up. Now, PatientSource has spent the last decade building amazing tools for clinicians to get their job done, to get in, to do things quickly that's in a familiar way and get out of the way. And we're very good at that. But we don't want to spread ourselves too thinly. We want a patient to have that same experience. We want the patient to come into the appointment armed with full knowledge of what's going to happen, what's going on with them, what has happened, but in a way that they can digest, and the clinician to be able to see that same information in the way they can digest, and each to have the right tools to do the next steps, without having to compromise. Now, if we sat down and we tried to build a patient interface, we would not do as good a job as a company who is founded from the principle that patients should be able to see their own records and participate. There's a simple solution to this, and that's to be collaborative, open, and develop an ecosystem. Connect the two together. Your clinicians are going to get the best interface they could possibly have. Know that their patients are going to get the best interface they can properly have, and no one's compromising. That's what you want. Yeah,
absolutely. That's amazing. Definitely. Transparency, again, I think we've mentioned before, but having the two experts together. So also, I think people might be interested to know about how it works alongside the NHS app, because it's such a big thing at the moment. So yeah, I don't know if you could, one of you like to.
Yeah, of course. So I mean, the concept of the NHS app is a really interesting one, and this is probably something that will come up through the conversations today. But I think that patients think of the NHS rightly, because it's called our national health system. They think of it as a national system, and anyone that knows in or with the NHS knows that that's not the case at all. It's so fragmented. And what the NHS Act does is it tries to present a consistent front door to patients, which is fantastic. And I think it's been a long time coming that patients need this in a trusted source. Now, what we do is we work, actually, again, back to being a partnership, we work in partnership with NHS Digital, who are the people that provide the NHS app, to expand on the capability within that. So for a whole load of regions within the UK now, they've put PKB behind the NHS app, so that instead of just having GP data within there, which is what the NHS app is built around, we provide a whole load of other data. So, for example, our partnership with PatientSource, data from organisations that are using PatientSource, that will be able to flow into PKB, but then it will also be accessible within the NHS app because of our partnership with NHS Digital.
Yeah.
And the reason I think that is so important is we are at the beginning of a journey of enabling patients and engaging with them. And although it's something that Mohammed has been trying to do for a long time at a national level, we are at the start of this. It's, you know, there's a long way to go. And actually, the NHS app recognising the value in partnerships with people such as us is really beneficial, because it means you get the best of breed sat behind and supporting it, but you get that trusted front door so patients can look at it and say, no, I know that I can trust this, I know that my data's secure. But it means the NHS doesn't have to waste loads of money reinventing things that have already been invented. Exactly.
Yeah.
They can just harness the best of what's out there.
Yeah.
So it's a partnership that we're really proud of, and we hope that we get to grow it more over the next few years as the ambitions of the NHS app grow as well.
So can you tell us a bit about how long PKB and PatientSource have been working together?
Well, we were talking about this earlier, and
Yeah.
I think it goes back about 8 years, and PatientSource is coming up for its 10th birthday. So most of the time that we've been around, we've been friends and in contact and things. But what's really important, I think, is that developing relationship, and essentially in an environment like this, where you've got, as Sally was saying, a fragmented NHS, you've got lots of different systems, that concept of open data and that sharing, integration, interoperability to ensure that data flows is really crucial, and that's why the partnership program is really important. Because if you take, for example, private healthcare in the UK, it's an area which is becoming more and more, the public can become more and more exposed to that through the outsourcing of elective procedures. So as the NHS has struggled with capacity during the coronavirus pandemic, we've seen a lot of those elective procedures being outsourced to the private sector, where they've been supporting the NHS. Now, if an NHS trust has an EPR, and they might even have a patient portal, and then your patient goes off to a private hospital, suddenly your data ends up in these different silos. And this is the challenge that the NHS has been facing for decades, really. And so being able to put our data, irrespective of which healthcare organisation it's coming from, into a patient portal like PKB that sits in the NHS app, really gives the patient a much, much more joined up experience of their care. And that's really, really important, I think.
So thank you so much, Patients Know Best and PatientSource, for joining us to chat about your partnership. It was brilliant, so thank you so much.